Well, we've got people coming in. I can't quite see who's coming in at the moment, but welcome. I can see numbers coming, but my list isn't showing me names coming up yet. So, welcome everybody, and to our webinar today. We're not starting just yet. We're going to start in a couple more minutes. But if you wanted to, just in our chat, if you could just, say hi or where you're from, is it Sydney, Melbourne, the back of Burke, just put it in our chat. What's the weather like? I know in Sydney here it's a bit warm. So yeah, but I suppose we're heading into our spring and summer. So if you guys just want to put anything in the chat for us, just to say hello. We'll get the webinar starting right on time. But yeah, if you've got any ways of wanting just to say hello to us, that would be fantastic as we're sort of getting ready for this webinar. And so depending where everyone is and what time zone you're in, this is probably lunchtime for everybody, having a little bit of lunchtime entertainment with us today. So yeah, so just waiting. But like I said, we'll start right on time. But we're just coming just to let everyone know we're here, and we're just checking if the chat's working. If you guys just there, or if you got the chat, or do you want the Q&A? If you wanted to put anything up there on the Q&A, you can certainly let us know. There, fantastic. Well, everyone's a little bit quiet, so I'm assuming you're having a quick lunch. Haven't got anyone coming through on their chat yet, so here we've got some more people coming through. Good. Well, it's afternoon. I was about to say good morning. That just shows a sign of what my day has been like. So yeah, good afternoon, everyone that's coming through. Anyone's coming through now. We're just asking people to say hi or let us know where you're from in the chat and what the weather's like. Like we're just saying, I'm in Sydney. It's a bit warm, and Dr. Dish is in Melbourne. So yeah, so if anyone wants to put anything in the chat for us, that way we can just see if the chat's working as well, because that will be your way of communicating with us throughout the webinar today. Oh, hello, welcome. Is it Alof? I hope I didn't pronounce it. I'm terrible at pronouncing names, so I do apologise if I just insulted you. But from Sydney, welcome. It's very, very nice to have you all aboard here today with us. Like I said, we will start this webinar on time, but we just came in a little earlier so you guys can just say hello and just make sure everything is fine and right to go. So yeah, fantastic. But I think if you're on the east coast of Australia, I think everyone's getting warm weather. I think the cool change's coming through with rain, but I think it's warm weather at the moment.
Yeah, we had
So,
a terribly rainy morning in Melbourne.
oh right, so you've got the rain. So
Yeah,
yeah.
I think the heat has passed us now. We had a couple of hot days last week.
So you've passed the baton to us.
Yeah.
So we probably expect the rain next. It's
I think
as
so.
they're coming through. So yeah, fantastic. Okay, we only got a minute to go, and then we'll get this all started. So people over it's very punctual. Can are on here. We'll get going very shortly. Well done. Fantastic. Okay. And so everyone's probably racing to get their lunch so they can sit. That's what I normally do with the webinars. That's when I think, oh, well, kill two birds with one stone. I'll actually watch the webinar and eat my lunch at the same time. So I'm assuming that's what a lot of people are probably doing.
Yeah, I was
Or who
surprised at how
knows?
many practices get the whole team involved. Like they put
Oh,
it up on a TV at the in the lunchroom and have lunch whilst watching these kinds of webinars.
yeah, I just love it when the whole teams are involved. Because when
Mm,
your whole team, I know from past experience myself with your whole team's on board, it just makes it's so more interesting in the practice. Everyone works more as a team, and there's just more excitement all round. So, yeah. Well, on that note, it is right on time. So we're going to actually get this webinar started today. So I will just introduce myself. I'll be hosting today's webinar, and I'm Linda. So I'm from Centaur, and I'm from the training and consulting department. But my previous life, I was a practice manager. So this is why I'm now going to sit alongside Dr. Dish today. So the webinar today, we're going to be looking at measure, improve, and grow, an evaluation accessing your practice and scorecard. But we're going to do things slightly differently, as you're going to see. It's not going to be the normal sort of scorecard that you think we're looking at. So let us get into our webinar. Here we go. Now, with all the webinars, there is a bit of housekeeping that we have today, and the housekeeping is that we are recording. So if you someone on your team couldn't make it to today's webinar, we'll send you the recording, and you can do exactly what Dish was saying. We could put it together, and you'll watch it together as a team and have questions, because as a recording, you can stop and pause and have all those recordings. We do have the chat, as you noticed, that we were just playing around with before. So if you do have any questions throughout the webinar, please just put them into the chat. We'll endeavour to look at them throughout the webinar. We might try and answer them if it's applicable within the webinar. But don't worry, because we do have a question section that we will endeavour to answer those questions that we couldn't throughout the webinar. So we will get to them. Now, who's our presenter today is Dr. Dish. Now, I'm very privileged to have got to know Dr. Dish over the last year, and he is a man of many hats. Oh my gosh, I don't know how he finds time to sleep at night, honestly. So he's actually an actual dentist, so he knows exactly what we're all going through. He has multiple practice owners, so he owns quite a few practices. So he knows about running practices. And I'm going to have fun with this. Young dental entrepreneur. I'm not very good at preneur. I seem to always want to do a French accent, so I do apologize for my pronunciation on that. But yes, he's an up and coming, full of ideas. Just sitting down and talking to him is just wonderful. But you can understand talking to him is wonderful because he's also a dental communication coach, which he's going to give us a lot of information and tips, will you believe it or not, through this webinar today on that communication, because as we all know, communication is fundamental in dental practices. So he is going to be that. So that's our man of many hats, and he's the driving force on this webinar today. Now, how we're going to work through this webinar today, we are going to be looking at a simple scorecard. And I mean, it's just a simple scorecard, because we're going to measure, improve, and grow. Like, this is how we would do it. We're going to look at marketing, and we're going to look at like Google conversions, the GMP matrix, website. We're going to look at like traffic impressions and conversions there, and the number of Google reviews. We'll also look at the financial, but once again, we're only just a very simple monthly review, revenue, monthly expenses, and the net profit. But what we're going to really focus on in this webinar is patience. We always do these matrix of looking at, the marketing and financial, but how are we sort of looking at our patients? Because without our patients, we don't have a business. So we're really going to focus a lot of this webinar on our patients. So we're going to look at patient retention, the number of new patients, number of cancellations, recall rates, and like I said, we're going to focus on it's getting two applauds here. Patient feedback, my favorite, absolutely favorite. And we look at patient satisfaction and patient loyalty. Once again, my absolute favorite. So on this note, I'm now going to pass the baton over to Dr. Dish, and he's now going to start us off on this interesting process we're going to have today.
Thank you, Linda. So yeah, look, as we are going through all the metrics that we can see here in this table, in the scorecard, and as we're giving you all of the different tips and tricks, we didn't want to just speak in hypotheticals. We thought that this kind of information is more easily digested when we can kind of relate to a person who has the same problem and a person who's going through the same struggles. So on that note, I wanted to introduce our character today, who is Dr. Tracy. So Dr. Tracy is, well, first of all, she owns a three-chair clinic in Melbourne Metro. So she graduated probably about 5 years ago. So she worked for 5 years before she took that leap into practice ownership. And she's owned her clinic for, we'll say, probably around 3 years. It took Dr. Tracy that 3 years to really get the hang of practice ownership, which is fair enough. Because as you said, Linda, with practice ownership, there's a lot of hats that you need to wear. And when you've got around 10 people working for you, it can be quite a lot. But now it's, come to that time that she's really ready to scale her practice and she's really ready to grow her practice. And she's realized that if she really does want to grow her practice and really does want to scale her practice, she needs to start shifting the ways that she works. So she needs to make sure that she's not only working in the practice as a dentist, but she's also working on the practice. And this is really where a scorecard like the one that we showed you is invaluable. Because a scorecard like this really, I guess it gives you a place to start. It gives you something that you can actually measure. And the really common adage that we always hear is what gets measured gets improved. So let's jump right into it, into our first topic today. And we're talking about marketing. So with marketing, I guess I just wanted to start off by reminding everyone that as we talk about all of these marketing metrics today, we aren't giving you actual marketing techniques, right? Instead, we are giving you the metrics to measure so that you know whether or not the marketing that you're doing is actually working. So let's talk about that. The first metric that I want to, I guess, talk about is Google conversions. Bear with me as I just press these buttons. It's a little bit laggy on mine. So Google ad conversions. Now, Google ad conversions are some sort of action that a potential patient would take in regards to your Google ads that you see as valuable. For example, seeing the ad is not really that valuable, but when you actually say click on the ad, or when you actually fill out a form or click on the call now button, that's something that's actually valuable. The next one that I want to talk about is GMB metrics. So GMB stands for Google My Business. Now, Google My Business metrics are a whole bunch of key insights that Google gives us that pretty much gives us information about how our patients are interacting with our business listing. So usually when you search up your clinic, you've got that section on the side and you can see how many times the patients are clicking on the call button, for example, or the website button, or the directions button. The next thing that we're going to be talking about is website data. So website data just refers to all of the information that's collected about the user activity and interactions on your actual website. So this could include things like your page views, the session duration, again, the number of clicks that you're getting on certain pages, and the number of conversions that you're getting across your website. And the final thing that we're going to be talking about today is Google reviews. So this is straightforward. This is simply the number of Google reviews that your clinic gets. Now, you're probably wondering where, these are cool. These are what my metrics are. This is what I need to measure. But you're probably wondering, where do I get this information? Well, let's start with the very first one, which is Google Ads conversion. So when you're on your Google account, you will be able to see the little grid button on the top right-hand side. When you click on the little grid button, you'll be able to scroll down and see a Google Ads button. Now, this takes you to the home page of the Google Ads where you can find all of this information. So you can see here on this little picture on the left, you've got an area where it shows you the number of clicks. You've got an area where it shows you the number of impressions. You've got an area where it shows you the conversions and several other things like your ROAs and your ROIs. You'll also notice that there's drop-down boxes there under each of those clicks, impressions, and conversions. In that little down arrow, you can actually look at other different metrics as well that Google will provide to you. For example, you can see your cost per click, which is pretty much how how much it's costing you for each conversion that you're getting. So this is the best way and the best place to look at your Google Ads conversion. This is something that you have to be following. The next thing that I'm going to show you is where you can see your GMB data. So first, make sure you're actually logged into your official Google account. And when you do and you type in your business name, a section like this will pop up. We're looking at the picture on the lower left here. This section will pop up and you'll see a little button there called Performance, right? When you click on that little Performance button, another window will pop up and that window will look like this. Now, once again, this is an area where Google has amalgamated all the data for you, right? So you can access, you can access this very, very quickly, and you can get all the information very easily. You can see an overview there. So this is, I guess, the number of people that have interacted with your profile listing. You can also see the number of calls that you're getting. You can see the number of people that are booking through your listing. You can see the number of people that have clicked on the directions button to see where you are, and the number of people that have clicked on the website button to go through to your website. So these are the easiest ways that you can measure and check your Google ad conversions and your GMB data. I hope that's making sense. I know we're covering a lot here. Now, the next thing that I want to talk about is the website. So now that we've covered Google, let's talk about the website stuff. I know this slide is looking very, very busy, but we'll kind of cover it one by one. So the best place to go to get all of the information about your website is to the team that manages your website, right? They should rather have all of the data pertaining to your website. And if you've got a good marketing team, they should be able to tabulate all of this information for you and give it to you in a nice, easy way that you can look over. So first of all, we've got this table on the top left here. You need to be tracking the overall traffic. This is effectively the number of people that are coming to your website. You need to be tracking where those people are actually coming from. So you can see on that table below, you've got, are they desktop users? Are they sitting on their computer and trying to find you? Or are they mobile users? Are they on their phone? Or are they tablet users? That's also important information. If we go back up to that top table, you also need to know the engagement rate of your website. It's not just good enough for someone to just click onto your website and immediately click off. We want to know the number of people that are actually engaging, people that are looking at the different tabs that you have on your website, maybe going into some of the different pages. And then finally, the conversions, right? So people who would go onto a tab, find what they're looking for, and then actually click on the Call Now button. So your marketing team should be able to give you this information, the traffic, how the engagement rate is, how many conversions you're getting from the website. And it's also important to know, if you look at the table on the lower left, exactly how those people are getting to your website. Are they coming directly because they've searched the name of your clinic up on Google? Or are they coming up because they've been, they've looked at a blog on a different website and they've found a link to your website? Or are they coming in from Google Ads? Are they finding your ad on Google at the sponsored section on the top and coming through to your website? So all of this information is really important because I guess it just helps you understand how your website's health is and how it's functioning. And the final table here on the bottom right-hand side is, I guess, what your most viewed pages are. So you can see that, it could be the Our Team section, which means that most people are looking for who's going to be treating me, what kind of team environment am I going to be walking into? A lot of people look at the special offers. What is the clinic offering me? A lot of people look at costs, or they look at the Contact Us page. So this is also really, really vital information that you have. Now, the final thing that is very, very easy to check here is your number of Google reviews. Simply type in the name of your dental clinic and you'll be able to see on the right-hand side under the GMB section, the number of total reviews that you have over there, and you'll be able to see how many reviews you have of each star. So let's now talk about why this stuff is important. Okay. All these stats, even though we've covered a lot, are important because overall they indicate the effectiveness of your advertising. As an owner, especially, it's vital because you're spending advertising dollars every single month. But how will you know how far each dollar is actually going? Right? Budget allocation is very, very important in this as well, because if you have a set amount of money that you spend every month, you need to know which ads are most effective. So you can put more currency towards those ads, right? You don't want to be spending money on ads that aren't working. Now, this information actually also gives us a lot of insight into. Sorry, that was budget allocation, right? You wanted to be, allocating your budget correctly. But this information also gives us a lot of insight into our patient behavior, right? It tells us what the patients are looking for. For example, you might see that patients are always going towards your teeth whitening ads. This allows you to actually mold your ads and mold your website to direct patients towards what's most popular right now. So if you know that your most viewed page is teeth whitening, means you might want to put a new teeth whitening campaign out. You might want to put out some special offers about teeth whitening, or you might want to write some blogs or articles about teeth whitening. And finally, the next thing that you need to be doing is comparing all of these figures on a month by month basis, right? You want to make sure that you are covering all of this every single month so that you know that there's steady growth. Because if there's not growth in the number of conversions that you're having, if there's not growth in the number of, patients coming to your actual website, then you'll know that changes need to be made. So, Linda, I'll hand it back to you to go over the scorecard.
Okay, so we go with that Dr. Tracy. So we're just now looking at her marketing from the scorecard. And you can see now we've just done a snapshot of the last 4 months. Now, obviously, we cheated with that, knowing that usually this time of year, from July to October, things do increase. But we can now see that now Tracy's now taking a good view at what she's looking at. You can see she's having a slow increase with her Google conversions. She's also seeing that the Google reviews are increasing. So once you know what's happening, sometimes it's not just a matter of set up and forget. You do need to monitor and see if it is working, just exactly as Dish was saying. You need to have a look at what's happening. And you can see her overall metrics are slightly improving. So she's with the Google My Business. So if you're monitoring it and you know where the information's coming from, then you know then how to do that marketing. So in July, Tracy may have been finding, oh, gee, I'm marketing in the wrong area, but now she's come around. So once again, we're looking at the directions. So lucky enough, we just happened to get a snapshot of Tracy just in that period. Like we always know, July through to October does usually with a lot of practice increases, because usually middle of the year is quiet because of, people get sick with colds and flus. So this is the best time for her to sort of monitor what she's doing. She can see her Google My Business calls are slowly increasing over this period of time as well. She looked at her website. So she was obviously in July, had a look at what was going on, and then she obviously has made some changes, which then has gradually increased. And so this is why, Dish is talking about monitoring on a monthly basis. So then you can see any changes. As we all know, there are trends that happen throughout the months. It's not something that's just a year-long base. And he's looking at the website traffic and the website conversions there. So that's Tracy's scorecard there. So you can just see how, just putting it in perspective and seeing it over a period of time, you can see how effective it's working in your practice. Okay, so now it's your guys' turn to let us know what's going on. So this is a little poll here that we're going to put up. So if you want to bear with me as I put my poll up here. So I've just launched the poll. So we've got the poll is up. If you could kindly let us know how you measure the success of your marketing. Is it something that you just leave for a marketing agency and they send you reports, or are you doing it yourself, or maybe you go, oh, I don't care about reports. I don't even do marketing. Yeah, so if you could just put that in our little poll and we're just going to see how everyone's feeling. Oh, look, we're getting a very strong indication of people are using a marketing agent and they're getting them to send them reports, Dish. So that's a good outcome. Actually, it's the winner. Yeah, if I wanted to put out there, that was the winning vote in our little poll that we had there. So thank you everybody who participated in that poll. Fantastic. Um, oh, and we got one that wasn't doing marketing, but that's fine. Yeah, sometimes they're so busy they don't have time and don't need to do marketing. Maybe they're doing something extremely well already. Fantastic. Great. Thank you guys. I appreciate you doing that poll for us. Greatly appreciated. Thank you so much. Okay, on that note, now I'm going to hand it back over to Dish.
Thanks, Linda. So let's talk about the patients now. I think this is the thing that I'm the most excited to talk about. And this is also the bulk of the presentation. So I think it's by far the most important factor because as you said, Linda, earlier, if we don't have patients, then we don't have a clinic, right? So it's all about your patients and your patient metrics. So first I'd like to, I guess, say, what is patient metrics? The patient metrics are data points that can effectively track the activity within your practice, right? Or the patient activity within your practice, rather. And this could include things like the number of new patients that you get, the number of new appointments that you get, your ability to be able to retain and recall the patients within your practice. But the other really important factor about patient metrics is not only about patient numbers, but also about how the patient feels. This is where we start to get into things like patient loyalty and patient satisfaction, because it's not good enough just to know that we've got all these new patients coming in, but we also need to know, are these new patients that are coming in actually satisfied, and are they going to be loyal patients who can give us good feedback about the stuff that we do? And I really do feel like patient satisfaction and patient retention is something that's really overlooked in dentistry and in practice ownership. If you go out to the market and you ask owners, everyone is obsessed with getting more and more new patients in through the door. And they're so obsessed with it that they forget to actually take care of and retain the patients that they still have. And a common visual that we use is the leaky bucket visual, right? So it doesn't really matter how much water is being poured into your bucket. If you have big, fat, gaping holes at the bottom of your bucket, then your bucket's never going to fill up. And it's the same with your practice. If you're losing too many patients, then your practice is never really going to grow. And this is something that's really, really important in this economic climate because your interest rates are up, inflation is really up, and the reality is, especially in this climate, that unfortunately our patients just are not spending the same type of money that they used to be spending. So we really need to make sure that we're returning to the basics, okay? And we're focusing our attention on not just new patients, but on consolidating our loyal patient base and making sure that our loyal patient base always have an amazing experience and that they keep coming back for the regular treatment. Because this is actually what will allow you to stabilize the cash flow of your dental practice during these uncertain times. So what I wanted to do in the next part here is actually divert a little bit. So I really wanted to give you some patient communication tips and tricks, right? These are the things that will actually allow you to wow the patients and make sure that they have an amazing experience every single time. And then we will go a little bit into patient retention and we'll go into patient satisfaction and loyalty. So we'll talk about how you can foster this with these tips and tricks. And then we will cover how you can actually measure your patient retention and measure your patient satisfaction. So this is, let's go into the next slide here. So the next thing that we're going to be talking about is a topic that I really, really enjoy. And that is mirroring. So mirroring, for those who don't know, it's a neuro-linguistic programming technique, right? And it's used to build rapport very, very quickly with your patients. And what it involves is imitating or reflecting rather the patient's actions, their behaviors, their emotions, or their traits. And when we're mirroring, our main objective with this is that we want to feel, I guess, connected with the patient, right? Because patients like dentists who are like them. If someone talks like you, if someone thinks like you, if someone acts like you, then you're more likely to like that person and you're more likely to be connected to that person. And that's our biggest goal as a dentist. We want to make sure that we're actually connecting with our patients. So let's go through a few things that when you're practicing, you can actually mirror. Let's talk about four things that I think are probably the biggest things. The first one is the patient's body language, right? So, with the patient's body language, you want to make sure that you are mirroring their hand gestures, mirroring their face gestures. You can see how the patient is sitting down with their hands. What are they doing with their fingers? Are they tilting their head a certain way? And once you look at these things, you can very subtly start to mirror them. Another thing that you can mirror is their verbal language, right? So, what you want to do when you're communicating with your patients is use the same language that they're using. So, if they use certain words to explain a certain procedure, if they use certain words to explain a certain problem, you want to be using those exact same words when you're diagnosing and when you're explaining the solutions. Because once again, using the same type of language makes you connected with the patients. The next thing that you can also mirror is their emotions and their energy. So if someone comes in and they're very, kind of dialed down, a bit maybe sad or a bit nervous, then you don't want to come in high energy because you're completely contradicting them. And it's the same thing when patients are speaking. If someone's speaking quietly and, they're a little bit shy and they're not talking very fast, and then you come in and you're high energy and you're explaining this and you're explaining that and you're showing this and showing that, there's a complete mismatch between you and the patient. So you have to make sure that you're mirroring their emotion, their energy, and you're mirroring the volume and speed with which you're communicating with the patient. And the final thing that I wanted to add onto this, and this is a really, really big one. Please, 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 when you're communicating with patients, make sure that you're using positive body language, right? Because if you're using the wrong type of body language, even if you don't mean to be, patients are actually going to label you potentially as rude or closed off or judgmental, right? But instead, when you're using positive body language techniques, which I'll cover a few now, patients actually think that you're open and confident and approachable. And some examples could be something as simple as just standing there with your arms crossed when a patient's trying to explain something to you. You want to make sure that you have an open body when you're communicating with your patients. Same thing when you're sitting down. If you've got your arms crossed and your legs crossed, you seem very, very closed off. And that's not the type of vibe that you want to be giving to the patient. The other thing is you want to potentially be leaning forward a little bit. You want to show that you're actively listening to the patient and that you're interested in what they're saying. If the patient's trying to explain something to you and you're walking around the room, typing notes as they're talking or putting your gloves on or adjusting your loops, it doesn't really give the type of body language to show that you're interested and you're there as part of that conversation. Right, so I really hope those two tips helped. I find that those two things were revolutionary when it came to the way that I communicated, right? Mirroring your patients and making sure that you've got positive body language when you're communicating. Now, the next tip that I want to give you is about explaining procedures. This is something that has probably by far been one of the things that I've received the most compliments about in my practice ownership. So it's all about how to explain procedures. So the first part of the strategy is the pre-procedural breakdown, right? So this involves a quick breakdown of the whole appointment right before treatment. So I would say something like, Mrs. Jones, today we're going to be doing a filling on your back tooth. Firstly, I'm going to get you nice and numb so you don't feel any pain. And then I'm going to use a small burr to remove the decay from inside the tooth. And when it's nice and clean and, looking really nice, the last step is going to be filling the tooth back up with a white filling material. Right, so this will only take you about 10 to 15 seconds to say. So you don't need to worry about, running behind or anything. So before you start, a quick pre-procedural breakdown so the patient understands and knows what's going on. Now, step two is what I like to call updates and encouragement. So as you're making progress through the appointment, I want you to pause at the end of each milestone and do two things. Firstly, update Mrs. Jones on what you've just completed and what's next to come. And secondly, praise Mrs. Jones on a job well done for the previous step. So you might say, Mrs. Jones, we've just finished removing the decay from the tooth and it's looking really beautiful and clean. And once you're ready, we're going to get started on filling the tooth back up for you so it's nice and functional again. And by the way, Mrs. Jones, thank you for being so still for me because you made my job a lot easier. So what you've done is you've given Mrs. Jones the chance to, take a little bit of a break. You've explained what you've just finished and what's going to be coming up next. And the other thing that you've done is you've also praised her. So that really does boost her confidence and her ego. So she's going to do even more for you moving forward. And the final part of the explaining procedures is the post-procedural breakdown. Now, this is very, very similar to the pre-procedural breakdown in which you would do a quick 25-second run through. But the most important thing, or I guess a useful tip here, is after you do a breakthrough, it gives you a really good way to emphasize the importance of what you've done and to, I guess, remind your patients that they have more treatment if they do. So you could say something like, Mrs. Jones, we just finished filling up that tooth. And by the way, Mrs. Jones, I just wanted to remind you there's one other tooth that has a cavity that's very similar to the one that we did today, and it's very close to the nerve. So, if it's not too much, I'd like to see you again in maybe another 2 weeks so we can do that filling just like we did for the one today. Right? So it gives you an opportunity to say, hey, look, this is what we've just done. And by the way, we've just got one more to do. And you know all the steps that are part of that process. Now, the reason why this has been so revolutionary for me is because I've found that it really does reduce the patient's anxiety, right? A lot of the fear that patients have when they come to the dentist, it's usually, surrounding the uncertainty of the procedure itself. So by explaining and encouraging the patient through each step, it really does help to alleviate the patient's anxiety and make them feel a lot more comfortable. And I found that it also increases compliance, right? When the patients understand what is happening and why it's happening, they're more likely to feel involved in the process because it's you and the patient working together as a team, right? And they're more likely to be on your team and do whatever it takes to make the process work. So I really hope that you guys can integrate explaining procedures into your everyday work. It doesn't take very long. It's not going to put you behind because these are quick 10, 15-second spurts here. Now, the final tip that I wanted to discuss today is a follow-up system. Now, this is what we use to get in touch with our patients, right? I don't believe that our duty of care ends just because our patients have walked out the door. A really important part of delivering a high-end service is actually to keep in touch with your patients even after they've left, because often after they've left the clinic is when they need you the most. So the first part of the follow-up system is what I like to call contact, right? This involves getting back in touch with your patient, right? We have to maintain open communication channels so that every single day your front desk is getting in contact with almost all of the patients from the previous day. Now, I do mean almost all patients, right? We're not just talking about the involved procedures like root canals or extractions or crowns. We have to remember that for some people, a clean takes months and months of courage to build up for. So we need to treat their clean just as importantly as we treat a bigger process, because to them, the clean is just as big or just as nerve-wracking as any other process. So there's three main ways that we can connect with our patients after they've left. The first one is if we text our patients, or you could call your patients, or you could email your patients. Now, I've found throughout this process of trial and error that really texting is the best way to go. Okay. It's the easiest way, and it's the part that gets you the highest response rate. Now, once you have, I guess, realized that, okay, contacting our patients is a must, and we're going to do it via text. The second step is what I call personalized communication, right? This takes your system to a whole new level. Because when you contact your patients, it's not designed to be some sort of bulk message that just gets sent out to the patients, right? We're going to be sending them specific messages for specific people. So there's two things that I want you to remember with this. When you're doing it, I want you to make sure that you address the patient by name. And if you can, even the appointment that they were in for. right? So you would include the treatment that they had. And secondly, you want to make sure that the message is actually coming from the dentist themselves, right? Because when patients see a service like this, they are blown away. And a message that, just to give you an example, a common message that I would send would be, "Hi, Mrs. Jones, Dr. Dish here from Dazzling Smiles Dental. I just wanted to check in to see how you're going after your extraction yesterday." So you can see here that we have used the patient's name, we've said that it's coming from the dentist, and we've also included the treatment that she had. So those are the three things that you need to do. And the final step of the follow-up system is a link to action or a call to action, right? So once the patient has given us some positive feedback, let us know that they're going well and that they're happy, what you want to do is send them a link which takes them straight to your Google review page. Now, the whole point of this is making it as easy as possible for your patient to leave a review, right? They click on the link and it takes them straight to the Google review page. Because if you're just simply telling your patient to leave me a review, that means that they need to type in your name, they need to find you on Google, click on the review button, make sure they select the right dentist, write the report, write their comments, and then press review. Right? There's just too many steps, and it's very easy for it to go wrong because what if they can't find you easily on Google? What if they actually click on the wrong dental clinic by mistake? Right? Those are all the barriers that we often face. So that's why it's very easy to send them the link, it takes them straight there. And having a system like this, contact, communicate personally with the patient, and give them that link, it really does show the patient that you care and that they're not just another number. You care about the fact that they're going to be okay after the appointment. So that is also something that was really, really revolutionary for me. All right, let's go to the next slide. So you're probably thinking that, okay, this kind of system sounds wonderful in theory, but you're probably thinking, how on earth is my receptionist going to find time to send, 20 different messages to 20 different people who had 20 different procedures done, right? And you're right, because I had the exact same problem when I was starting out. And it was, this kind of system can be very error prone and it can be quite a laborious task. But I want to introduce to you a product that I've actually been using for the past year. And it's something that has totally, I guess, changed the way that my practice does this follow-up system. And that product's called Patient Care. So essentially, Patient Care is Australia's only patient experience management platform. Right. And it's perfect if you have Dental for Windows because it really does integrate beautifully for Dental for Windows. And in a nutshell, what it does is automate every single step of the follow-up system that I just mentioned. So if you think back, the first step was contact, right? Now, we were manually contacting every single patient by going through the books and typing their names into the mobile phone. But you no longer have to do that because what Patient Care does is it integrates with your books and it automatically sends out a follow-up message to all of the patients from the previous day. Now, the second step was personalized communication. Again, you don't need to go into the books and make sure you've got the patient name right, make sure you've got the treatment right, because what Patient Care does, integrated with Dental for Windows, it already knows the patient name. It already knows the dentist's name. And because Patient Care can actually read codes, it actually knows what procedure the patient came in for. So the message that gets sent is fully personalized. And finally, the link to action was the final step of the follow-up system. Well, Patient Care will actually send that link if the feedback was positive, right? So we don't need to do anything because the patient has gotten the text, it's fully personalized. And if we got good feedback, well, either if we got bad feedback, we're able to address it and fix the problem. And if we got good feedback, then Patient Care will automatically send that Google link. So it's quick and it's easy. And what you can see here on the slide is kind of an example of the type of message that Patient Care would send. So you can see there it's got the person's name and it asks questions like, how are you feeling after your appointment? Do you have any pain after your appointment? It can ask a question like, how would you rate your experience on a scale of 1 to 10? Or it could ask a question like, how likely are you to recommend this clinic to one of your friends or family? And of course, if we get good answers to these types of questions, it will send a link. And all of this information is beautifully amalgamated for you into an easy to read dashboard, which looks a little bit like this. So this is where we're talking about how do we actually measure that patient satisfaction? How do we actually measure that patient loyalty? So there's a few pictures here that I want you to see. So as you can see on the top left there, that picture shows us the response rate. It shows us the number of people within the practice that are actually responding to what we're sending, responding to the messages. The next picture there is patient loyalty, right? So that's where we can see that, month on month, we want to make sure that all those bars are green because that means that all of those people are promoters, people that have given us a really good rating. We want very little red or yellow. And finally, there you can see at the very bottom is the Google reviews. Okay, again, you can measure all of this. You can make sure that you can see there that the number of Google reviews over time is increasing. So people are actually seeing these messages, giving you good feedback, and then giving you a Google review. So having a system like this, it really does, I guess, give you a really quick, easy, and effective way to mold your patient experience into the best possible version. You need to make sure that you have some sort of system in place where you can actually track this data. You need to know if your patients are actually happy with the service that you're providing. Because once people walk out the door, if you're not asking the patients, then how do you know if they're actually happy? How do you know if you did well? If the dentist is consistently getting a really poor rating from patients, then it means that they could be doing something wrong. They could be doing something wrong, whether it has to do with their clinical work, or they could be doing something wrong when it comes to their bedside manner. And the other thing is staff behavior. It actually lets you correct staff behavior. So it's not just about the dentist, it's about the whole team. Because patients through this follow-up system can actually leave comments and concerns about every aspect of their visit. So they might say that, hey, look, I was really happy with the dentist, but I found that the receptionist might have been a little bit rude or a little bit pushy. So you can very quickly correct this because you get the feedback straight away and then you can act on it. And the most important thing that I guess I wanted to mention about this as well is that you need to remember that with all of this information about the patient experience, it starts to have a trickle down effect. It starts to trickle down into all of the other metrics that we're measuring. So you want to make sure that, if people are having a poor experience at your clinic, it's going to start to impact the number of referrals that you get. It's going to start to impact the number of new patients that you get. It's going to impact the recall rate negatively. You're going to have less people coming in. You're going to have a higher amount of no-shows or cancellations because people are, going to say, "Yep, I'll book an appointment to your face," but as they walk out the door, they're going to be like, "I'm never going back to that place again." So if you don't know that you have all the feedback, if you don't see the feedback and know that you're getting this feedback, then you can never really improve. So with that, I'd like to hand it back to Linda. I think you're going to go back to the scorecard for us.
Yes, we're going back to Tracy, but I'm just going to put Tracy on hold for a minute because I thought that part of the webinar was fantastic. Because I have always been a strong believer in when you run your dental practices, see things from a patient's perspective and you see what it's like to be in their shoes, and that where that mirroring comes in. When you were telling me that, I suddenly uncrossed my arms, my legs, that I'm just sitting here in my chair cross-legged. I went, oh, gee, I better stand to attention. And I think that does have a huge impact. And it's not just the communication that you have with the patient in the dental chair, but it's also the communication at reception and the phone. The phone, I think people don't realize that is the biggest form of communication and your biggest impression. And all those tips that Dish had said is so vital on that phone call, because a lot of times the phone call can also be your first impression of what they actually see. They can see you on websites and you can make you look really great, but if your reaction that when they phone is doesn't match it, it works in well. So this is what leads me into, and also too, I have to say, I am biased, and I will say right out now I'm absolutely biased. Patient care, I think, is brilliant. So I'm going to say it's brilliant in the sense that it reaches every single patient, because as Dish said, it doesn't have to be your TLCs that you have to call. It is those someone can have a bad experience just in examination. And everyone thinks, oh, examination's nothing. It's quick, easy, in and out. It's not a money maker. Get them in and out, and we'll get them back for the other treatment. But that can have the biggest impact. And that's the biggest impact you have. So every interaction you'll have with your patient is so vitally important. That's why we've really focused on this type of metrics. So in this case now with Dr. Tracy, she obviously started seeing this avenue that we've had here. To look at, because she started looking at what number of new patients. So we liked looking at that, and she said, "Oh, how am I can increase that?" Now we all know that if we're looking after our existing patients, gee, they're going to blab and they're going to tell people how lovely we are. So it's got a dominoes effect of us actually looking after existing patients. And as they always say, cost effectiveness. Look after the existing patient, it costs a little bit more effectively. Word of mouth these days is a little bit different to years ago. Still the same process. People will still ask. It's just that they'll now go on their social media and ask, "Oh, do you know who's the best dentist?" And then once they find it, they go to your website. So there's a few avenues that they will click. So obviously Tracy's been looking at that. She's also then looking at the cancellations by actually then focusing on her patients and really listening to their expectations, and probably addressing those anxieties that they have. She's now found that her cancellation has actually reduced. And also this impact too as well too is that if you start focusing on patients, your number of patients coming to you increases too, which also does reduce your cancellations, because people don't want to miss out, because if they can't make your appointment, they got to go another 3 weeks. That does make it easy for them to come through. So the patient loyalty, this is really good. This is actually what we call the NPS, where this is the likelihood of actually a patient being referred back to you. And this is in my favorite, and I won't deny it, my favorite patient care do have that NPS score there. So from the feedback that we have, we can actually figure out what's the likelihood of the practice patients, referring you back to the practice. And then, of course, you're looking at your recall rate as well. Once again, it's the importance of actually, communicating with patients and letting them know that their treatment's important, and then coming back for recalls. It might seems like it's a given, but it is actually just some patients just need to be constantly reminded of that, and so their patient recall rate has increased as well as we go over. So this is, once again, we're just highlighting the importance of sort of monitoring. And throughout this, we know Tracy has been monitoring and done things like Dr. Dish by introducing patient care into the practice. This has now helped with her looking at her patient's metrics. So on that note, it's back to you guys. We want to know how your feelings. And we're now looking at the poll on a scale of 1 to 5. How important is patient post feedback to you? Okay, so let me bring up my poll and bring it up. So in this, it could be extremely important, only semi-important, neutral, not important, not important or at all. So it's purely up to you. From Dr. Dish, in my opinion, I won't persuade you in filling out the poll, but yeah, we do find, the post feedback is important, and and finding it out sooner than later. So having the ability to find it out after their appointment is so much more important than finding 6 months down the track when they've left and gone to someone else. It's a lot harder to get them back. But so if they've had a bad experience or even a good experience, them telling you and looking at it. So if it's a bad experience, you want to action it straight away. And it could be, something you could easily fix and persuade them right back. And maybe something just not done correctly or whatever, we can certainly do that. But Dish, we're getting, extremely important. Isn't that nice to see? And
One
important.
one of
Yeah.
the things that it still continues to amaze me. This is from before when I wasn't using patient care, and even to after when I did start using patient care. Even though most people or most dentists realize that it is extremely important, I find that actually out there in the real world, most dentists aren't doing it.
Mm.
Because still to this day, people, or patients rather, will respond back to the message and say, "Oh my gosh, I've been going to the dentist for 50 years, and no one has ever checked in on me after the day after the appointment."
And it's that's makes you interest. Oh, put my teeth back into you. I'm slurring my. Um, uh, that brings to an interesting um point there. Dish is that patients, are probably feeling more comfortable if you're getting them feedback the next day afterwards. They're relaxed, they're at home, they're not anxious about being there. So they're more likely to give you feedback and more feedback than you realize. I
Mhm.
know I've been hearing the feedback I've been getting is that a lot of people say, we're getting more information from our patients with their feedback, more than if we either called them up or by the time they come around for their next appointment, they've forgotten what they had. But if we've just triggered them, and like I said, they're relaxed. This is why, when we do messages, we do it the day after. People go, oh, why can't you just do it an hour after? I'll tell you now, my doctor does that. And it's like, I've just got over you telling me some bad news. I don't really have time to think about. But give me a day and I've had time to process it, then I'll assess the whole situation and give you feedback. So yeah, it's quite interesting. But any
Absolutely.
but anyway, I'm now handed back to you, Dish. It's now back to you.
Thank you. So now that we've finished up with patients, the next thing that we're going to be talking about is the financial metrics. Give me a sec here. Awesome. So, with the financial metrics, again, let's first talk about exactly what it is. So, the financial metrics are key data points that can, I guess, track the your practice's financial health. And we want to keep this really, really straightforward and simple for you. So, there's really only three things that you need to look at to track this financial health. So, the first, you have the monthly revenue. We track this on a month by month basis, by the way. I feel like that's just the easiest way to go about it. So we have the monthly revenue first. So this is the money that your business is actually producing and bringing in. Then you have your monthly expenses, which again makes sense. It's the money that your business is actually spending. And then finally, you have the net profit. And this is the money that you have left over. If you wanted to keep it really simple and straightforward, these are the key metrics that provide insights into how well your practice is, managing resources, how well it's controlling the costs, and whether or not it's actually a sustainable clinic. Now, you're probably wondering, where do I go to look for this information? Well, what I think is the best way to go to get this information, or well, there's two places, and Linda, I'll be throwing it over to you soon to cover the second. But where I like to go is to my accountants, right? Or rather to the accounting software itself, if you have access to that. Because whether you're using MyOb as the accounting software or Xero or any of the other ones, all of them should quite accurately capture this information. It should be able to capture the money in, should be able to capture the money out, and it should be able to capture the profit that you've got left. And with all of this information, it should be able to give you quite a detailed look, and it should be in some sort of table format. So Tracy went to her accounting software and she got a table similar to this. So you can see here in this table that you've got your income up at the very top. And then you've got a long list of expenses. These are kind of like, the normal expenses a clinic would have over any given month. And then at the bottom, you've got your net profit. So effectively, you've got your income minus all of the expenses, and that leaves you with the profit. Now, it's really interesting because you can actually, expenses is already broken down quite detailed. So you can actually see, exactly what you're spending your money on, which is fantastic. But if you wanted to take this a step further, you can actually also break down your revenue or your income. You can actually find out exactly where your income is coming from. And that might mean going to your practice management software where you can see what kind of procedures is bringing in the most income. And if you wanted to break down your income even further, you could actually go again into the accounting software and see what are the dentists or what are the clinicians that are producing the most amount of income. And we'll get to it, but all of this information is going to be helping you drive decisions moving forward for the business. But Linda, I'll hand it back to you because I think there was another place where we can go to kind of get some of this information.
Yeah, so as Dish said, essentially a lot of people will go to their accountants and to get that information. But you can also you get run reports within your practice management system, and it'll be looking more at your sort of revenue, and they'll be looking at how did you get to your revenue. So you can do those simple reports, which are a little like I always like it. I'm stealing this from someone, but two-dimensional reports where it's just basic. This is what the production was, and this is what was made up of. So you can do that through your practice management system. So like Denver Windows, you can do your reports. Or if you want to go that little bit further, you could look at a practice analytics program where they have different layers of information. So they might give you what your production is for the month, but then go a little bit further. How is that broken up? How is that, how's that broken up between my providers? How is that broken up between treatment? It gives you all that information that you have. And also too, it also lets you know how much of the production have you done, how much are you discounting? Because we know sometimes we don't like talking finance, so we try to discount. So how much are you discounting, and could that be looking at another way of, maybe you should be managing that slightly differently? So these are where you can get this additional information. But obviously today we're concentrating a lot on just the patient side, but these are where you can get those additional information to really expand out the financial side of things for you. So it's back to you, Dish.
Yeah. And the final thing that I wanted to just discuss in terms of the finances is, I guess, why is this important? Why is it important that we are looking at these things? And look, we all know that finances are obviously important. At the end of the day, if your expenses are outweighing your income on a month by month basis, then you don't have a viable business, right? You need to make sure that you're looking at this information to make sure that you're actually on track and you're actually hitting your goals. And getting some sort of table like that, which shows your income, your expenses, and your profit, is what gives you a really clear picture of the financial health of your business. And as I have been harping on about, you need to be measuring this month on month. Okay, we need to be making sure that as you're progressing through the years, that the income or revenue that you're generating is slowly increasing, right? This means that you're improving. And you need to also make sure that your expenses are either slowly decreasing or at least your expenses are stabilized per month. Um, and having a table like that is really, really beautiful because you can see straight away, like, month number one, for example, in July or in June, we spent, $500 on stock. And then for some reason in July, we've spent $2,000 on stock. Straight away, you can see red flags, alarm bells, and you can start to assess that and make decisions based on that. The other really cool thing is revenue management. You know, you need to understand where the income is being generated from because it helps you to actually prioritize those high performing services. As I said before, if you realize that majority of your income is actually coming from your teeth whitening process, then it means that you might actually want to allocate some more marketing funds towards teeth whitening ads. You could also realize that, hang on, we've got almost no income coming in from aligners. So you might say, you know what, let's put up a few free aligner consults or a few ad campaigns about aligners. So knowing where your money is coming in from, or rather where it's not coming in from, can really identify opportunities for growth for you. Cost cutting, kind of talked about this one already. Having tables and having all of those metrics prevents you from overspending. When you're looking at the numbers all the time and you can see that they're steady, it prevents those numbers or those expenses from going too high. And this is really, really important when you're operating on a budget, because you can very quickly tell if stock is being misplaced or if you're overspending on something that you shouldn't be spending on. Are your staff going into overtime too much? Have the wages skyrocketed over the past 6 months for some reason? And the final thing is, once again, it gives you that kind of direction. It gives you that vision of where your practice is moving. Knowing where the money is coming in and where the money is going out helps you make those big decisions on, where can you invest? If you realize, for example, that a lot of your money is coming in from your crowns, but you realize that your lab bill every month is so high, then you can start to think, is it going to be financially viable now for me to invest in an in-house crown milling? But if you don't have those financial statistics, then you're not going to be able to make these decisions. It's all about decision making. So I'll hand it back to you, Linda.
Great. So we're back to our Tracy, and Tracy's it's just going to be the very basic. Like we said, we're going to just be looking at her monthly revenue. We're looking at her monthly expenses and her net profit. Now you might notice to go, but oh, her monthly expenses are going up. Well, yes, if you are increasing your revenue, then at some point you are increasing. Maybe you had to get a new staff member on board, or you did have to get some, there's more stock being used. So just because your revenue's increasing doesn't necessarily mean that your expenses won't increase. They will increase. But once again, as Dish was saying, monitoring how you're using those expenses that you're using. But I think we wanted to sort of let you know that from this, you can see by looking after patients helps with the revenue. And then the dominoes effect is then we look at the expenses that go with that revenue, and then do we get a profit from there? Because what we're saying, if we're not doing dentistry for free, we are actually having to pay. But if we're getting our patients in the door, they're happy with it. And like with the revenue, and we're looking at, like your data that you're getting, you can see trends that are occurring. As Dish was saying, you can have a trend. You might find, it's in the middle, October is the time to be really promoting your bleaching because everyone's getting married. So, let's just see how we're going. Or it's, the football season. Let's look at, the mouth guards or how to prevent stuff so you can actually govern it. So with Tracy here, she once again, we did do this the good part of the months where we actually increase everything. So July is usually quiet because, as we often find, practice get a little bit quiet during July because there people usually don't feel like going out. It's cold, or there's a lot more illness around, so there's less likely of making appointments. But as we get into August and September, we get the spring is in the air. We're feeling a lot better. So on that note, we've got one of our final polls here for you guys to get your opinion is, and it's not coming up for me. It's just decided. There we go. What's your primary goal when reconciling your financial data? So I'll just get our poll up for us for that one. There. So, what's your actual goal for your financials? Is it looking at a year to, month information, monthly looking at the information? As Dish says, he finds that very important because you can actually see what's happening and, capture it. Monitoring the practice health, is it doing well? It might be like in your mind, and I've actually had this a lot of times where people say, "Oh, I'm bringing in X amount of money," but then their overheads have been so high that the actual profit is actually been quite low. So it didn't reflect on how healthy the practice was. So yeah, so we got monitoring the practice health has come up, and a lot of people say all of the above. Fantastic. That they're looking at everything year to month, monitoring the health, identifying opportunities of growth. Brilliant. Yes. Is the way
One
to
of the
go.
beautiful things about dental practices, Linda, is that although in the early stages of a dental practice, as the revenue is increasing, there is an increase in the number of expenses. But a dental practice is a little bit different to other businesses in which, after a certain point, the expenses do get relatively capped. Because you don't have an unlimited amount of space, an unlimited amount of chairs. So your staff, I guess, is capped at a certain point. So it gives you an opportunity to cap your expenses, but your revenue is limitless because what you can start to do is with the same number of staff members, you can actually, and relatively same number of stock, you can actually start to do different types of procedures, which means that your expenses get capped, but your income starts to increase. So we usually see, around that when you're starting to do that 100K, 200K per month, that's when your expenses start to get capped, but the revenue is limitless.
That's a great point. Absolute great point there. Dish. So yeah, fantastic. So I'll just stop that launch there. Okay, so just to cap it off, what we're saying we're doing scorecard, we thought we'd do the homework, but to cap everything off, basically we just wanted to highlight, main aim of today was to highlight the importance of the patients. We often hear about, the marketing side and the financial side, but we don't seem to ever get, well, really, let's focus on the patient and that communication. Are we following up? Are we really meeting their expectations? It's different to think we know they're meeting it to actually meeting it. So sometimes don't the old saying, can't judge a book by its cover. Just because the patients come in, they're smiling happily with you, doesn't necessarily mean that they'll give you a good feedback or good Google review. Some people can disguise it very, very well. So being on top of all of that is very, very important. So what we'll do is when we send the email out, and I believe Mona, who's on our webinar tonight, is sending out the recording of the webinar tomorrow. I will just give her just the little scorecard, the simple scorecard we've got. Obviously, you'll use it in more depth, but what we want you to use it as is a guide to say, okay, what are we going to, especially those ones that probably not monitoring, is for you guys to have that discussion. So when you look at your marketing, maybe discuss your marketing agency and ask a little more in-depth questions. Sending reports, but get them to explain that as reports a little bit from what Dish is saying. And then we'll show you what to look at with your patients. Are you doing the follow-up? Do you know what your patients are feeling after their every appointment? Is this something you need to address? And then obviously at the end of it, if we getting all those patients through the door, hopefully we'll get the financial reward. But once again, you want to obviously be speaking to your accountants or there to make sure you are on track, make sure you are working. So we'll just send that little simple scorecard. It's simple, because honestly, we could do a scorecard and we can make it perhaps hundreds of pages long. We could put everything in, but we just made it simple for you to just action and things for you to just to be at forefront and to go through there. So I know we've if you want to know a little bit more, and because Dish is full of information, so what we like you to do is follow him on Instagram with our patient care app that we have. He gives out some fantastic tips. So even if you get up and out, and I think you can look at past, he's done some great videos. Just 30-second videos to give you some tips throughout. So if you really enjoyed Dish's talk today, then follow it on Instagram with our patient care app, which you just use the scanner there, and then you can then follow him through his, and my love of patient care. But it's not just about patient care. He's giving you some really good tips, like he's done today. It was some really good tips. If you would like to know more about patient care, which like I said, I am biased and I think everyone should have it. But like I said, I'm absolutely biased. I'm just going to put up a poll. So if you are interested, we can get someone to reach out to you and give you some more information about it. It does give some amazing feedback and what you can be looking at, but we'll get the team. Now, for those of you that are watching this afterwards, couldn't get to see us in live, we're not going to disadvantage you because you haven't got the poll to tell us and we can reach out. Just give us a call at Centaur and go to pick the sales line when they come in and ask for someone to give you a demo. So if you're watching this afterwards and you go, oh, what that poll? Reach out to us. Someone on the team will certainly give you a lot more information and guide you through. Like I said, I'm biased and think we all should have it, but I will leave that up to you guys on that one as well. So I'll do that poll. I know we've gone a little bit over time, but I just think we had so much. If anyone's got questions, because you're all very quiet throughout the session, so if you've got any questions, Dish and I are quite happy to stay on just for a little bit longer. I know Dish can't stay too long because the man of many hats, believe it or not, gave up time in his busy schedule today to actually do this webinar. He's actually been treating patients. He's going to go back and treat some more patients this afternoon. So I'd like to say thank you for that. So if you want to take that opportunity to ask any questions, look, if you like me afterwards and think, oh, I should have asked this question, you can always email us and we can answer those questions that you have. So, like I said, but just to recap that we are sending out the webinar recording to tomorrow so that you guys have got it there. So if you couldn't make it today, or anyone on your team couldn't make it, you can actually give them the recording and they can watch it. Or if you want to watch it with your team, you can do it. Great. We've got a thank you. Oh, thank you. Oh, great. It looks like we're getting all our thank yous. So on that note, Dish, I'm going to come to my thank yous. Oh, so it's come to my thank you because I want to give a big big thank you to Dish. He does give a lot of his time to us here at Centaur, and we really appreciate. He's full of information and knowledge that we all love to share and be with, and I've really enjoyed working with him on these webinars. So I'd like to say thank you so much, Dish. It's been a privilege, and I think no problems, everybody. Everyone's just saying thank you. So I'm glad
Yeah,
I hope
thank
you
you.
enjoyed it. I hope
Yeah,
you really
thank
enjoyed
you
it.
everyone for attending, and thank you, Linda, for hosting as well.
No problems at all. Well, on that note, because we've run a bit over, I'd like to say go off and enjoy your day, and I will get Dish to run off and treat his patients. And I'm sure everybody else on this webinar has got patients to treat as well. So thank you for your time, and all have a great day, and we'll hopefully see you at the next webinar.